Hi, my name is Dr.Winnie Nyanya, a public health specialist specializing in HIV care. I've partnered with Ponea Health today to talk about HIV awareness. HIV is a viral infection. It's caused by HIV, which is a human immunodeficiency virus that causes diseases in the body. And the severity of the disease when it's advanced is what we are calling AIDS. AIDS is acquired immunodeficiency syndrome, which is a combination of many illnesses in the body that lead to low immunity and illnesses that make someone weak and sick, and that is what we call AIDS. HIV can be transmitted through many means, and mainly it's through a mixture of bodily fluids from one infected person to an uninfected person. The most common route of transmission is through sexual contact, and we also have other forms of transmission through blood transfusion or maybe an organ transplant. And in small infants, we see transmission also happening through breastfeeding. So that is how HIV can be transmitted. We know not all bodily fluids, though, can transmit HIV because we have things to do with sweat, and maybe saliva. Things like kissing cannot transmit HIV. So we have myths and misconceptions about HIV, how HIV is transmitted, but mainly is through a mix of bodily fluids. And this is bodily fluids that have a high risk of transmitting the virus from the infected person to the uninfected person. So for one to be at risk of acquiring HIV, we have behaviors that may put someone at risk of getting HIV. For health workers, it could be a prick. It's occupational exposure, where they could prick themselves with a needle with blood from an infected person. We have other populations that can also be at risk of getting HIV, and that is in the general population, where people have multiple sexual contacts and they don't know the HIV status of their sexual partner. We have those who inject drugs and use drugs, and also we have those who are female sex workers or men who have sex with men. These are populations that have a higher risk of getting HIV, and mostly it's behavioral when they don't know their HIV status and they expose themselves to HIV with people whose status is not known. We also have children who are born of HIV-infected mothers. If the mothers do not take the necessary precautions during pregnancy, breastfeeding, and delivery, then the infant can also be infected with HIV from mother to child. HIV transmission can be prevented through, first of all, knowing one's status. If you know your HIV status, you will adopt behaviors that will prevent you from acquiring HIV. Once you know your HIV status, then it would be good to know your partner's HIV status as well, so that if they're HIV negative, then you take the necessary precautions not to get HIV. If they're HIV infected, then we also can be able to take necessary precautions not to get HIV. So that is the first step of preventing HIV transmission. The others is behavioral, where we ensure we have what we call safer sex practices, use a condom, and also stick to one partner, and that way we'll not be able to acquire HIV. And we stick to one partner whose HIV status is known so that we don't acquire HIV. Thank you for joining me in this discussion. You can book my services at ponea.com. I look forward to engaging with you more in the next episode. Thank you.